Hello and welcome to New Mouths Podcast. I'm Sarah, and every week we'll journey together through the intricate world of dentistry. From dispelling myths to exploring the latest in oral health, we've got a packed show for everyone. Ready to dive in? Let's go! Welcome to New Mouths Podcast, where we dive into all things dental and oral healthcare. Today we're focusing on a topic that affects everyone: common oral conditions and dental diseases. Joining us is Jake, an expert in the field. Jake, it's great to have you on the show.
Thanks for having me, Sarah. I'm excited to talk about oral health and hopefully help our listeners recognize the importance of taking care of their teeth and gums.
Absolutely, so let's jump right in. Cavities are something most of us are familiar with. Could you explain what causes them and how we treat them?
Sure thing. Cavities or dental caries are essentially holes in your teeth caused by bacteria that feast on sugars in your diet. They start as light brown spots and, if left untreated, can deepen and require a dentist's intervention, using fillings or crowns to fix the damage.
Oh, that sounds like something we certainly want to avoid. Now, what about gingivitis and periodontal disease? How serious are these gum issues?
They can be quite serious. Gingivitis is mild gum inflammation, but it can escalate to periodontal disease if not addressed. This more severe stage of gum disease can permanently harm your gums and jawbone, and is often characterized by symptoms like inflamed and bleeding gums.
Definitely something to keep an eye on. And bad breath or halitosis, is this always an indicator of a bigger issue?
It can be. While it might just be from something you ate or drank, chronic bad breath is often linked to poor oral hygiene or more serious issues like gum disease. It can be treated both by professional dental care and natural remedies, depending on the cause.
I see. And dry mouth, what typically causes this discomfort?
Dry mouth can come from a range of factors, including medication, tobacco use, certain diseases, or therapies like chemotherapy. It often comes with a sore throat or bad breath and can make you quite uncomfortable.
That's quite a variety of causes. Now, what about tooth sensitivity? What's happening when our teeth hurt from hot or cold?
When you feel pain or discomfort from extremes in temperature or certain foods, it's likely tooth sensitivity. It's a common issue and can be caused by many things like tooth decay, gum recession, or even cracked teeth, just to name a few.
Interesting. What about dental plaque and calculus? How do these affect our oral health?
Dental plaque is a bacteria-filled sticky mass that forms on your teeth, especially when you consume a lot of starches and sugars. Calculus, or tartar, is what happens when plaque hardens, and both can lead to tooth decay and periodontal disease if not properly cleaned.
Got it. And can you tell us about cracked tooth syndrome? How does this happen?
Sure. Cracked tooth syndrome typically comes from bruxism, which is when you grind or clench your teeth. It can cause pain when biting down in a certain way, and while some cracks may be minor, others could cause major issues if they grow. So you definitely want to see a dentist if you suspect you have a cracked tooth.
Makes sense to me. Now, dental anxiety is a big one. So many people dread going to the dentist. How can this be managed?
Yes, it's quite common. Methods like sedation dentistry can make dental procedures less intimidating for folks who suffer from severe dental anxiety. It's about making the experience as comfortable as possible.
Good to know there are ways to ease that stress. Moving on, what is oral thrush and who is at risk?
Oral thrush is a yeast infection that appears as white spots on the mucous membranes in the mouth. It's not initially painful, but people with dry mouths, weakened immune systems, or uncontrolled diabetes are more at risk.
That's valuable information. And oral cancer, this one sounds particularly serious.
It is. Oral cancer involves abnormal cell growth leading to sores that don't heal on their own. Early diagnosis and treatment are crucial here.
I understand. Now, what can you tell us about temporomandibular joint dysfunction, or TMD?
TMD can result from injuries, long-term teeth grinding, among other causes. It's very uncomfortable and affects the jaw joint and muscles, making it difficult to chew or talk. Treatments can range from mouth guards to surgery, depending on severity.
That's quite the range. And gum recession, what exactly is that?
Gum recession occurs when your gums pull away from your teeth, exposing roots and leading to sensitivity and risk of decay. It's often a result of factors like genetics or tobacco use.
And lastly, what about dental erosion? What's happening there?
Dental erosion comes from acidic substances wearing away the tooth enamel. It's a chemical process that doesn't involve bacteria and can seriously damage the teeth over time.
Jake, you've shared a wealth of knowledge with us today. It's clear that taking care of our oral health is crucial. What's the one thing you want listeners to take away from our conversation?
The main takeaway is that many dental issues start in a mild form and are manageable if caught early. But if you neglect them, they can seriously impact your overall health. So always speak to a dentist as soon as you notice symptoms.
Great advice, Jake. Thanks for educating us and our listeners on these common oral health issues. And thank you all for tuning in to New Mouths Podcast. Until next time, keep smiling and take care of your teeth and gums. That's all for today on New Mouths Podcast. I'm Sarah, and it's been a pleasure sharing with you. Always remember, the foundation of a great day starts with a smile. Join us again next week for more enlightening discussions. Until then, keep those smiles radiant.